Hi again. Welcome everyone to Counseling Practice Lesson 3. Anyone that is not in my class or anyone that just wants to learn about professional ethics in medical and mental health, I am here for you. My names are Dr. Eunice Menja. I am a licensed marriage and family therapist, but a candidate. That means that I am operating under a supervisor. Today marks 1 year since I got my license here in Oklahoma. So today we're going to explore a very crucial area of our work. Professional ethics is in counseling and occupational therapy, especially for my students who are taking occupational therapy at Jomo Kenyatta University. Whether you're offering therapy in a hospital, rehabilitation center, or rural clinic, ethics guide how you interact with clients, colleagues, and the public. In this session, um, I'm going to just try and help align ethical principles with real life examples to focus on both global standards and also Kenyan realities, of course. But because I am practicing in America, you might hear a lot of American language. You, as obviously a future health professional or medical provider, will face choices that will test your values, and training ethics will be your compass in those moments, especially when you need to do the right thing. So let's go. So, what are professional ethics? Professional ethics are a set of guiding principles that define what is right and obviously responsible with a profession. Think of the professional ethics as your moral compass or moral GPS for your decisions and your behavior when you are dealing with clients or patients. So, in counseling and occupational therapy, ethics are going to shape how you treat your clients, how you handle sensitive information when it comes to you, especially regarding your client, and obviously when it comes to making clinical judgments. For example, let's say a patient offers you money or a gift to get faster services, and that is something that is very common that happens especially in public hospitals where I come from. Ethically, you must decline and explain that all clients are treated fairly. Or consider a situation where you overhear a nurse discussing a patient's therapy progress loudly in a hallway. So, what would you do? So, ethically, that's a breach of confidentiality. What you should do is protect your client's dignity at all times. These are what helps you to really build trust and protect your clients. These ethics or guidelines are applicable across medical and counseling fields, and there's no way to get around it. People get hurt when we are not professional. People get hurt when they realize that their diagnosis is being shared to anyone. So please pay attention to everything that you're going to be learning about today. Obviously, if you are already in this field or if you're a student, this is something that is very, very important to know even for your test. So, when we look at the core ethical principles in counseling, there are 6 universal ethical principles that we follow in health and counseling professions. According to American Code of Ethics, and also we are also going to talk a little bit about what Kenyan principles are when it comes to counseling or medical health. So the first core ethical principle is autonomy, respecting your client's right to make their own decisions. If a client refuses to be treated or they refuse to get therapy, even when you know it would help, you must respect their decision. We don't force people to agree to treatment unless they are obviously they are going to harm themselves. We have to have consent, and sometimes even in that situation, you would have to have someone else from their family that actually takes the lead to give that consent. So we do not provide services by force. If you have a client that's in the middle of the session and say, hey, I'm done, I don't want to do it anymore, you cannot force, not for money, not for any reason. So the second ethical principle is called beneficence. If you want to remember this, obviously remember the word benefit. Always act in the best interest of your client. So suppose a child is showing signs of abuse, even if the parents are respected members of the community or leaders or in the government, you must take action to protect the child. So you have to do good for the client no matter what. I have come across some people where somebody is in the hospital and maybe they have been abused by a spouse or their parent, and the doctors don't do anything. Obviously, here in America, you are mandated to report any type of abuse for elder abuse or even children, because they are vulnerable. So you always have to act in ways that benefit your client. So remember that word beneficence. And of course, the third core principle is non-maleficence. So remember the word none. Do not harm. So do not harm. Never use therapy techniques or any tools in your field that you are not trained in. Never do something that would hurt your client using the wrong methodology or giving wrong medication or even wrong advice because you're biased, or maybe that worked for you. It could damage the client, or even their mental health becomes even more serious. And that's really, even takes me back to why it is very, very important for people to be very professional and also trained in the area of practice. So the other one is justice. Number 4 is justice, fairness and equity in treatment. So you have to be fair and equal in service. Do not give better treatment to someone just because you know them. Don't give better treatment to someone because they're paying you more. Don't give better treatment to people because they belong to a tribe, or they look like you, or they believe like you. So everyone requires fairness and equity in treatment. That's another core principle. So the other core principle is fidelity. So everyone knows about keeping promises and being loyal. So be loyal and keep your word. If you talk to your client and you tell them this is what you're going to provide, these are the services you're going to provide, make sure you do provide them. Some people get paid and they just do the work because they they have the authority over the client, and they never deliver the services. So you need to follow up. If you make a promise, follow up, do it the right way, follow up with your clients, make sure that your services are providing help, or they are being effective, because just receiving money or seeing someone because you're getting paid, you are getting a salary, and you don't know that they're getting help, that is not keeping your word, and it's not being loyal. And the last one, the core ethical principles, last and not the least, is veracity. Always tell the truth. Always tell the truth. Do not lie to comfort a client or hide mistakes. So if you make a mistake, if you told your client something that is, something that was wrong, you gave them a wrong diagnosis, you gave them wrong advice, you can come back and tell the truth. We are all humans, you can make mistakes. Do not lie to your client. Do not lie to your client. If you know that your client is getting worse and you keep telling them they're getting better just because they're coming to your clinic and paying you, that is obviously is not right. So it's not professional, it's not ethical. Do the right thing, and you get your reward for doing your best. So those are the 6 principles that must guide every session, referral, or interaction that you have with your client. All right. So the common ethical dilemmas in medical counseling or mental health, there's, obviously in real practice you will face many ethical dilemmas. Let's talk through some common dilemmas that we get to face. One of them is handling confidential information. Imagine a teenager client tells you they are pregnant and begs you not to tell anyone. You need to weigh their right to privacy with their safety. If the situation presents a serious risk to their health or someone else, you may need to disclose, but only through appropriate legal and professional channels. So some of this, obviously, information is actually it's guiding principles, especially in America. If you're seeing a teenager, if you're seeing somebody who is 14 and above, they're entitled to the information. You cannot relay that information to their parents unless there's a teenager that is planning to harm themselves or harm someone else. So remember that. So otherwise, they have to give consent whether you have to disclose, but you don't disclose. Actually, you tell them to disclose to the person that they need to disclose to, if it's their parent, and unless it is also a case of child abuse, that you have to make sure that you report as mandated by the law. So the other one is dual relationships. So, sometimes we get in our field, we get to see our friends or our relatives in our places of work. You may be assigned a client who is actually your friend or your relative or your neighbor or someone in church or even a distant cousin. So treating them can affect your objectivity. It is not that you cannot treat them, but you might not be objective because you know this person before and you're going to continue seeing them even after that. So when it comes to issues of confidentiality, that is also somewhere that you have to draw the line. So it's better to refer that person to another practitioner when boundaries are at risk, because you might not be able to set boundaries with your cousins. You might not be able to set boundaries with somebody whom you see in church, because then issues of confidentiality are going to be jeopardized. So the other dilemma is informed consent and client understanding. We always want to ensure that the client understands what therapy involves or what counseling involves, what type of treatment they are going to receive. In some cases, like obviously with children or minors or people with intellectual disabilities or developmental disabilities, ensure that both the client and their legal guardian fully also understand the process and they give consent freely. So in my practice, that is something that we always have to discuss in the beginning, the informed consent and client understanding, whether if they don't have the ability to understand what you are going to do with them, how they're going to meet their goals, the method that you're going to use, make sure that they understand. And if they are not, if you're in a dilemma like that, you're not sure if they understand, it could be maybe translation barrier because of different language or dialects. So you might have to use someone else to make sure that they understand that and they give their consent freely. So the other dilemma is obviously comes in when it comes to cultural beliefs versus professional recommendations. So family may believe that their child has autism, and that autism is caused by witchcraft, and might resist therapy because they want to go to a witch doctor, or they might just want to pray about it. So instead of imposing your values because you're learned or because you have an understanding that autism is not caused by those things that they believe in, you're gonna have to respect their belief while explaining the benefits of therapy. So use the language and examples that they relate to. If you are from a different culture, if you're from a different tribe, if you're from a different nationality, different faith, you might have to look for someone else who can explain to them better that what their beliefs are might not be true. And of course, we always believe in science. there are people that obviously want, cultural values and tie-ins to impact their therapy. So you have to also get that clear when you're beginning to treat someone. You might want to ask them, because maybe they are Islamic, maybe they want their faith to be part of their therapy procedures or practices. So therapy can help your child speak and care for themselves even as you pray and seek spiritual healing if you're a parent. So that's something that you would want to tell a parent and make sure that they are clear and they understand. Some people believe that, things like immunization or things like that. And, it's as a profession, it can cause dilemma, because you want to do the right thing for the client and you want to actually give them the autonomy. But when you are in such a dilemma, obviously always seek professional advice, including from your team or even from your supervisors. Like I said from the beginning, I am working under supervision because I'm required to work under supervision for a certain number of hours, and that's what I'm doing. So my supervisor is always there for me to ask questions like that when I'm in a dilemma. So in other cases, it might be your supervisor, it might be your boss, it might be your employer that you have to ask for advice before you proceed. So the other one is obviously pressure from families or institutions. You may be told to change a report so that patient can get financial help or may qualify for insurance, or they may be qualified for school admission. Obviously changing the reports to favor somebody, for somebody else to gain, and not telling truth. Obviously that is unethical. So even when the family or the person that is paying pressurizes you to tweak clinical documents or documentation, you have to stand by your clinical judgment. If somebody is not fit to work and you need to give that evaluation, if you're in that position, you're gonna have to tell the truth. What if you give somebody a good recommendation from your profession and say that they are fit to drive or they are fit to fly a plane, and then accidents happen? So you would obviously have that blood on your hands. So always be ethical. There are dilemmas because people pay and they will tell you to do things that you're not supposed to do, but do not actually agree to the pressure. Always tell the truth. So risk and safety concerns, if a client hints that they are suicidal or they have suicidal thoughts but ask you not to tell anyone, as I said again, we do have reasons why we cannot keep that information. It might this is also a dilemma. Should I tell because it is your client's information? But that situation is where you ethically must act to protect their life, and even the other person, maybe they intend to no harm. So this one is called duty to harm. We also have that as also another ethical principle. Even if it means breaking confidentiality to involve crisis intervention services, like calling the police or calling the emergency people, or even calling the parents or the relatives and telling them, hey, your loved one has threatened to commit suicide or threatened to harm someone. That one obviously is a dilemma that that you do the right thing, save life. So these scenarios require a lot of wisdom, a lot of training, a lot of experience, and often, most of the times, consult with your supervisors or even ethical board. I do have a board, the Oklahoma Behavioral board. I have to make sure that I'm following the principles that guide our field. I cannot just make decisions based on my knowledge alone. So there is something that called CE, ethical standards that were adapted for Kenya. In the Kenyan context, we teach the CE framework. So as I said, there could be other people who are watching, my video from different countries, but we have C for ethical standards, which is not obviously a global principle. So S stands for service. So you always prioritize, put the client's well-being first. S, So always prioritize the client's welfare, not your comfort or gain. If your shift ends but your patient is in distress, are you supposed to sign out and say, hey, my shift is over, I'm gonna leave you here, die? And you've seen some places where those things happen. So you can stay a little longer until you hand over and make sure that your client is safe. So the other one is ethical integrity. So E stands for ethical integrity. Be honest and morally upright. Refuse any bribe. We don't accept bribe for referrals. We don't accept bribe to see a client in emergency situation. Refuse any bribe to change report or prioritize clients, because that is you're gonna have to uphold honesty and moral behavior in this field. The other one is accountability. On your actions. If you make an error, report and correct it. Don't blame others. Be responsible for your actions. We know that there are places where people will blame the nurse, or they'll blame the doctor, or they blame the client or the patient or the family or anybody else. So if you make a mistake, you have to be accountable. Be responsible for the actions that you have caused, okay, your behavior. So contextual application in Kenyan healthcare, avoid corruption, favoritism, and the like. So these principles align with global ethics, but respond to challenges that we often face a lot in Kenya, like nepotism, tribalism, bribery, and lack of oversight in rural clinics. As leaders in healthcare, you must set very, very high standards. You're Gen Zs, you're young people, you know the right thing, do the right thing. Don't do what the other people are doing if it is not right, if it's corruption. Avoid corruption. Avoid giving medication to the people you know and leaving the people that you don't know without medication. To be fair, justice, okay? So we're gonna go to the next slide, and if you have any questions, please always comment under my slides, like, share, subscribe. So I'm gonna talk about confidentiality in mental health or medical counseling. We say that confidentiality is a key ethical principle. As a therapist or as a mental health counselor or as an occupational therapist, you're going to learn that private things about your clients are supposed to be private. If you learn private things about your clients, diagnoses, they share secrets, if they're in therapy and they share things, that is supposed to be between you and your client. Even when you have supervisors, we don't always disclose everything that the client has said. Sometimes when I'm consulting, I might not even use a name. I might not even use a case number. I would just ask like a general question to ask for guidance. So you may be working with a child that is autism. The parent shares that their father is abusive. You must keep that private unless the child is in danger. Even then, you report the legal channels, not by gossiping to your workmates or somewhere in the staff room or in the break room. Watch where and how you talk. Don't discuss clients in hospital corridors or in staff room or WhatsApp group. Secure your written notes and digital records. If you have a computer, make sure that it is locked. It has passwords. Always use discretion with family and cultural expectations. So if you don't have to share anything, don't share. If it is about somebody's in danger, make sure that you use discretion. Authorized personnel would be like your principal, your supervisor, and if maybe the medical billing admins or things like that. So even though they have to maybe bill your client, if you're not the one billing, they still cannot read the notes. There are some places where we have systems where we write our medical or our therapy notes and nobody else can see them except us and the client, if that makes sense. So as I said, use discretion. It's not everything that you have to share with family, even for when it comes to children, unless someone is in danger, because it's still your client's information and should be kept confidential. So when it comes to ethics and cultural sensitivity, this is a very broad topic. This could take many, many slides to explain. But as Kenyan practitioners, or even American practitioners, cultural ethics matter deeply. Our clients come from very diverse places, tribes, religions, and social background. Now we even have, just gender, conflicts and things like that, sexual orientation. You must be respectful and non-judgmental. This is a time where and we're in an era that you cannot be judgmental. We cannot judge other people's lives and how they live their lives, regardless of what we believe in. We have to respect beliefs and practices. Avoid imposing your values or my personal values on my clients. And that is very easy to do, sometimes. But our duty is to help client. It is not to impose our values. So, as I said, this is another example. If a family refuses mental health treatment because they believe in witchcraft or they believe in just prayer alone, take time to educate rather than dismiss them. If you're not a Christian and they want you to use the Bible, you can always refer them. Do not impose your culture or your religion on them. Offer therapy while supporting their desire for prayers or rituals if it doesn't harm the client. If you're a Christian, but if it does, because it's probably going to change who they are, just refer them out. So be aware of those spiritual and tribal considerations. Use cultural appropriate communication. Obviously, that, just use logical language where needed. Avoid terms that stigmatize people. Don't say, the things like your child is useless, your child is incapable, your child, just say, if your child has special needs, you don't say your child is delayed or your child has, is a special kid or things like that. People use very different terms, but maybe say your child has, learns differently from others. Cultural humility builds trust. So you have to be humble. Even if you're a smart person and you find someone, your client is not as smart as you are, your client even didn't go to high school, when you have your degree or you have your master's, always, just be sensitive how you communicate. Use a language that they understand. Don't use jargon. Make sure that you break down the treatment plan to their level of understanding. Sometimes you may go to a doctor that can really intimidate you. They're using very big names and you don't understand. Even in mental health, we have very big names, very big words. We want to make sure that we are very sensitive and we consider all our clients. Okay? So I want to talk a little bit about boundaries. Boundaries are what protect our clients. Boundaries protect your clients and they protect you as a provider and your reputation. They protect you as a provider, they protect your reputation as, also. Avoid friendships and especially romantic or financial ties with your clients. I have seen this a lot in Kenya. This is very punishable in America. This is how punishable it is. If you treat someone, let's say, for example, you come to my clinic and I'm a female, and maybe down the line we meet somewhere, maybe on a dating site or maybe in somebody's wedding or something like that. We cannot date for life. This is lifetime. We will never be in a romantic relationship so long as I was your therapist. And this is why. So every time a client comes to you, you have authority. That client to you is actually in a vulnerable situation. They might tell you their secrets, they might tell you about their weaknesses, their strengths, they might tell you about their financial situations. You might take advantage and say, I'm gonna marry this guy. He said he's very rich. That is very punishable in America. You will lose your license in the morning. Okay? Do not do it. Even in Kenya. I've encountered, I've run a rehabilitation clinic in Kenya where clients would come back and they would say they want to date so and so in my clinic, and I would say no, that cannot happen. Do not share your phone numbers with your clients because that's unethical. Even if that is not in your ethical guidelines or professional guidelines, please do not take advantage of your clients financially. Do not have business. Do not do business with them. Do not accept expensive gifts. We do have guidelines, and those are boundaries that are very, very important to really protect you, because if you do that, you'll be taking advantage of your clients if you don't keep boundaries. So keep your roles clear and very professional. So there are times when you need to refer if someone is making advances, if somebody is asking you for your number and they're insisting and you're telling them, no, I'm your therapist, we cannot do this, I'm your doctor, we cannot do this. Use supervision when you're unsure what to do with such a client. Sometimes your client can put you in a very awkward situation, and that's why all my students who are JKUAT, they are able to visit my clinic where I'm gonna give a project for you to do. Make sure that you are observing even the way you sit with your client, the way you address your clients, where your client sits versus where you sit as a therapist or counselor, just to make sure that you protect yourself and you put even physical boundaries. Okay? So I say that when you have a dual relationship with a client, you have more roles than just being the provider with your client. So if you're treating someone, maybe someone you know, or your neighbor's child, you're offering therapy to your landlord, it may make objectivity very hard, as I said. But if you were to meet with that landlord, maybe you haven't paid rent. Can you imagine arguing with your landlord and who is also your client? Maybe in counseling because they have mental health issues or they are sick. You could take advantage of them, or they could take advantage of yourself. So make sure that you keep those boundaries. If someone comes and you know this person very well, they go to your class or you went to class together and they're bringing your children to treat them. In mental health, it is very important that you refer those people out because you will not be objective. Let's say you're treating someone and they begin to confide personal feelings about you that's inappropriate. You must redirect or refer them and tell them, state your boundaries from the beginning. You make sure that you tell them who you are to them and the role that you hold. Avoid accepting large gifts, as I said there earlier, or invitations to their weddings. The clients will do that to me sometimes, or they will send me messages and messages that are inappropriate, and that's the time I remind them about my boundaries. So these, because they might create expectations and pressure, and stay professional for your own sake and for the sake of your client, because it can lead you to a lot of problems. Okay. So there are consequences of unethical practice. So if you don't follow the guidelines, remember these are just highlights. There are more that may be required by your board. They might be required by your employer. But the ones that I have highlighted, if you break confidentiality, if you don't keep boundaries, if you don't practice professionally, there are consequences of unethical practice. Unethical behavior has very, very serious consequences, and I have to remind everyone that goes through my class or anyone that I meet, you could be reported to your regulatory board. You can lose your license. It harms your clients, loss of client trust. There are legal repercussions. Professional misconduct, are reported. So damages your reputation and your career forever. Why would you risk to do that? For myself, I cannot even imagine losing my license. There are many years that I have been in school. For in Oklahoma, you have to have a master's degree to practice, as a licensed therapist. And then you have to do this exam, the national and also the state. The national exam is the biggest monster that you have to, especially for LMFT, which is licensed marriage and family therapist. That exam is so hard that you cry when you pass. You don't even celebrate. You're just like, oh my gosh, how did I do that? Many people fail. They do it even 10 times, and it costs you so much money every time you redo it. So why would I want to risk my license after working so hard? I have to work for over 2,000 hours, almost 3,000 hours to be a licensed, to be fully licensed and be off supervision. Why would I risk my license because of not being ethical? So I want to be ethical because the consequences are really, really rough, especially as I said in America. So I don't know about where you are and where you're going to be working, but always think about consequences when you are making decisions. If you're reported to a regulatory board, you will lose your license. You will even go to court, face legal charges. You can be fined. If you falsify a report to help a patient get maybe disability checks or disability funds, even if your heart is in the right place to help, it is still wrong. You can be prosecuted. You can go to jail. Imagine if you disclose a patient's condition to your friend, and then your friend goes and write it on social media, and then the patient may commit suicide, or they will sue you, and you lose your credibility forever. That affects your reputation and your career. Your character is really your currency in your field of profession, so protect it. If you're not of good character, the system will catch up with you. It might not catch up with you very soon, but one day it is going to catch up with you, and the consequences are just so brutal, so serious. So as I conclude, if you have any questions, obviously I do have some sources that I have used for my slides. Every time I teach this course, I always teach something different. I like to be a little bit updated. So I know that I got some of the information from Kenya Counseling and Psychological Association, KCPA, Professional Ethical Standards for Counselors in Kenya, American Counseling Association, ACA Code of Ethics. It's obviously my Bible. I have to follow everything that American Counseling Association says, and I know that it's borrowed by a lot of countries because their ethics, obviously, their ethical guidelines obviously are very important, and I want to say they're very informing. So if you want to read more, if you are practicing somewhere else after school, if you want to go to other countries, it's always good to read the ACA's Code of Ethics. It's very informative. Obviously, it's very great. And I'm going to give a project on how to find it out so that you can also find it out, and make sure that you read it for yourself and summarize it as part of our grading project. So beware, watch out for those messages, okay? So if you have any questions, obviously don't forget to contact me. As I said, ethics is about what is right, what is fair, and what is honest. It protects your clients, and it protects you as a profession, and yourself, and your family. So we use the frameworks like the ACA Code of Ethics, Global ANC in Kenya to guide our behavior, because we want to behave in a professional way. We handle dilemmas with our wisdom, what we have gained is goal, respect people's culture. We make sure that we guard confidentiality for ourselves and even for our clients, because we don't disclose our personal information to our clients, so that we can avoid the blood relationships, which are not very easy to avoid, but you have to make sure that you're always guided by some ethics like the ACA Code of Ethics. So I'm going to leave you with some questions just in your mind. What ethical challenge might arise in your own community, or wherever you're going to go do your internship, or where you're going to be placed to do your practicum, or even where you're going to be employed? How would you explain confidentiality to a client who wants to involve their whole family in their treatment? How will you apply C values when facing pressure or temptation? You can write your answers in the comment. You can just think about those questions. Just reflect on them, because it's hard. Those are dilemmas that we're going to talk about. But I'm so glad that you took this class. I'm so glad that you are taking this class with me, because I have highlighted the most important things that you need to be thinking about it. But most important, most important, treat everyone fairly, regardless of where they come from and regardless of their class. Okay, goodbye.